you know that 1 pint of blood could save up to 3 lives? According to American Red Cross and statistics, every 2 seconds, someone's in need of a blood transfusion. That's about 3,200 people per day. My purpose of this speech is to inform you of the blood donation process. This is not to convince you or anyone else to donate blood. I will be talking about who can and cannot donate blood and the screening process of the donor. What ways can a person donate blood, and how often a person can donate, and where the blood goes after it's donated. Let's first talk about who can donate blood. According to Sarah Riggs, eHow.com, anyone 17 years of age or 16 years or older with parents' permission can donate blood, and also they have to be at least 110 pounds or more. So now let's talk about who can't donate blood. According to MichiganBlood.org, people that cannot donate blood are people who have HIV, who's positive for AIDS, blood disease, epilepsy, chronic lung, liver or heart disease, and hepatitis such as A and C. During the blood donation process, there will be a screening process. The first part will be a questionnaire about your health. According to the FDA, blood centers are required to maintain a list of unsuitable donors. So basically, if you don't pass the questionnaire, they put your name into a system and you're not allowed to donate blood. Also, during the screening process, you'll get a fingerprint to check your red blood cells volume, your protein levels, and your blood type. You'll also get like a mini physical. You'll get your blood pressure checked, your pulse, and your temperature. When you get your fingerprint test, this will tell you, like I said, your blood type, and there are 4 blood groups. There's A, B, O, AB, and it also comes with a positive and negative, which is the Rh factor. As you can see from this chart here, O negative is a universal donor, and AB positive is a universal receiver. So in case of an emergency, they don't know your blood type, they will give you O negative. Once you have been cleared to donate blood after your screening process, you then will move to the next step, which is donation. According to the Mayo Clinic, there are 2 ways to donate. There's whole blood donation, which is blood that is divided once it's taken into 3 components. And there's also the automated donation, which removes a specific component of the blood, such as the platelets, and returning the remaining components back to the donor. As you can see here, with a whole blood donation, there are 3 aspects. There is plasma, white blood cells, and red blood cells. According to St. Jude, the whole blood donation only takes about 30 minutes to do. The automated donation, however, is a different process. You connect it to a machine which draws out the blood and separates the components. The needed components is collected into sterile bags, and then the unused component is what goes back to the donor. According to St. Jude's, this process takes a little longer, about 2 hours. After the donation process, the blood is sent off to laboratory for further testing. According to the American Red Cross, some of the tests that is tested for the blood will be hepatitis B, hepatitis C, immunodeficiency known as HIV, the West Nile virus, and STDs such as syphilis. Let's take a second to talk about when can a person donate blood and how frequently. You can always start whenever you need. It's always open Monday through Sunday. But however, depending on the type of donation you do, there is only a frequency. For example, blood, whole blood, you can only donate that every 56 days. Platelets can only be donated every 7 days up to 24 times a year. Plasma every 28 days up to 13 times a year, and double red cells every 112 days up to 3 times a year. finally, I want to talk about where does the blood donation go. So, according to the miblood.org, hospitals go and call the blood centers for their donations and what type of blood they need. Platelets, for example, platelets are used for hemorrhaging cancer, organ cell transplants, bone marrow transplants, and heart surgery patients. Plasma users are the burns, hemorrhaging, immunoglobulin deficiency, liver transplant, bone marrow transplant, increasing overall blood volume, and trauma cases. The red cells are used on patients with trauma, surgery, anemia, blood disorders, and blood loss. In conclusion, as you can see, I have informed you on the process of blood donation, who can and cannot donate, the screening process of the donor, what can the donor donate and how, when and how frequent a donor can donate blood, and where the blood goes after it's donated.